Hi everyone, my name is Alexis Rumps and today I will be taking you through my FDR Disability Campaign project. So a bit of an introduction. So who is FDR? So FDR, Franklin Delano Roosevelt, was the 32nd President of the United States. He served in this position from 1933 until he passed away unfortunately in 1945. He was the longest serving U.S. President by serving more than 2 terms, and he served 4 terms. So, what disability did FDR have? So, FDR suffered from poliomyelitis, commonly referred to as polio. He was diagnosed at the age of 39, and it ultimately led to the paralysis of his legs. So, what is polio? Polio is a highly infectious disease that, when spread, can lead to full paralysis. It's a viral disease spread through either fecal oral contact or respiratory droplets. There unfortunately is no known cure for polio, but it can only be prevented. So, some historical context of FDR. So, FDR assumed his presidency during the Great Depression, and he helped people regain faith in themselves during a trying circumstance. He was diagnosed with polio at age 39, and because of this, the function of his legs diminished. He did attempt to regain function in his legs, and he did so by practicing swimming. So, FDR lived with polio throughout his presidency, and he did attempt to hide it from the people. He was under the impression that the people would view his disability as a weakness and deem him unfit to serve. So he had this fear that people would just not accept him for his disability. He also demanded that no cameras be present when transferred in and out of vehicles or any homesteading to and from podiums when he was giving speeches. He also used mobility aids such as walkers. He had leg crutches. He used actual crutches, and then he usually always had an arm on either side to hold on to. So, some historical context of polio. Prior to the polio vaccine becoming available, there were multiple polio epidemics between 1948 and 1955. So, many public places were avoided to prevent contracting it, so not much social engagement was occurring during this time. Also, because it was during the Great Depression, not much money was available to have events such as this socially, and also parents tended to keep their kids home from school and not let them see their friends. There were machines invented referred to as iron lungs, and these were used in an attempt to treat the paralysis of the legs of individuals. They also helped the patients breathe and may have even given them a longer life of those that did suffer from polio. In 1955, the polio vaccine was developed by Dr. Jonas Salk. Prior to the vaccine, however, the disease had been a major cause for disabilities in children. In 1961, the second vaccine was developed, and a third was developed in 1963, and these helped to control the spread of polio in industrialized countries. And then by 1994, polio was considered eliminated throughout North America, despite some small pop up cases here and there. So, some advantages of having a disability in a political campaign and a candidate themselves. So, candidates with first-hand understanding of a disability seem to provide more empathy towards people, which also builds stronger connections. They also are likely to prioritize policymaking and establishment in relation to healthcare, accessibility, and other social services. They exhibit increased disability awareness and can inspire the people to become more aware, inclusive, accepting, understanding, and make those with disabilities feel heard, seen, and included. He's an example to other civilians that you can be in leadership positions with a disability. People back then used to think that because you had a disability, it made you different and that made you less than everyone else, and FDR proved that wrong. They can also promote new discussions regarding policymaking, as well as coming up with new ideas. And as a leader, problem solving skills are increased as living with a disability promotes innovative thinking skills that can transition into traits as a valuable leader. So, some modern parallels of disability rights. This includes the emphasis shared regarding human rights, self determination, motivation, and equality and inclusion. This can be compared to the reproductive rights movement, which they both emphasize body autonomy, self determination, and again, equality and inclusion. In the present, disability advocates are working to ensure access to education, employment, healthcare, and other essential services for those with disabilities. And an example of this can be the Americans with Disabilities Act of 1994, also known as the ADA, which works to provide access to education, employment, healthcare, and other services, as well as decrease discrimination. Also, adaptive technologies play a vital role in legislation in terms of addressing discrimination and promoting equal opportunities for those with disabilities. Also, empowering those with disabilities to develop self advocacy and motivation is something that can be seen from FDR's time throughout office. In summary, FDR served as 32nd president of the US. He was diagnosed at age 39 with polio, which ended up taking full control over his legs and ended up in total paralysis. He served his presidency during the Great Depression, and polio vaccines were developed to prevent the inhibition of polio. Having a political candidate with a disability creates a stronger connection and development of empathy between civilians and the candidate, and new discussions on policy can come from a political candidate who is devoted to helping his people. And these are my references. Thank you for watching.